Dr. Prada, what exactly is breast augmentation?
Well, breast augmentation is essentially when we use an implant to fill out a woman's breast to make them larger.
Is there anyone that would not be a candidate for breast augmentation?
Really, there's nobody who I would say wouldn't be a candidate, but in a lot of cases, there are patients who require other procedures at the same time to make their breasts look better.
What about a woman who maybe is in her early 20s, wants kids, but not yet? Should she wait till she's done having children to have augmentation? When's the best time?
I really let the patient determine that. I think that most of our patient population, or a lot of the patients that we operate on, have not had children. So in that case, I think if a patient's interested in having breast augmentation, she should go ahead and have it done. There are certain things that we tell them afterwards that I think can improve upon their result long term, and that would be maybe to limit the length of time they breastfeed and control the amount of weight they gain during their pregnancy.
So are they able to breastfeed with the implants in?
Yeah, most patients can breastfeed, although if you've never had children, I always tell the patient, I don't know if you'd be able to breastfeed if you haven't had a child, because we don't know if you'd be able to do that before your surgery.
So what happens to the implant during pregnancy?
Well, what happens is the breast changes. The breast obviously gets larger, and when the breast gets larger, the skin stretches. If the skin stretches for an extended period of time, after pregnancy, it doesn't always go back to the form that it was before. And sometimes what can happen is the breast can descend. The implant can either descend, or the breast can actually descend off the implant.
So let's talk a little bit about implant. When you do the surgery, what type of implants are available? I'm assuming there's more than one.
Yeah. There are two that are FDA approved. There's the saline implant, which most people are accustomed to hearing about, and then approximately 4 years ago or so, the FDA reapproved the silicone gel implant, which is a round device. It's filled with a silicone gel, has a silicone shell as well. These have been shown to be very safe, and a lot of the issues that the FDA had potential concerns with earlier have shown to be not true, and so we use those most often.
Which is a better implant?
Really, I think each implant has different benefits. The saline implant obviously is going to provide you with a little bit more of an ability to make symmetry, because you can adjust the implant, whereas with a silicone gel it becomes pre-filled. Oftentimes we tell the patient we prefer, as plastic surgeons, a silicone gel implant because it tends to be a little bit softer. You can feel the implant a little bit less, and it tends to carry more of a teardrop shape to it, which is a more natural shape to the patient.
And then in the surgery, where does that implant go exactly?
Well, we usually place it underneath the pectoralis muscle, and those are the muscles under your chest wall, obviously. We do not cover this implant completely by muscle. It's usually the upper border and the medial aspect of the breast that's covered by the muscle, and that helps prevent rippling or distortion of the breast after the implant is placed.
Do you ever put that implant on top of the muscle?
I rarely do. I usually find in most cases putting it under the muscle provides for a better, I think, cosmetic result, and it really decreases risk of complications tremendously. There are a rare group of patients who are bodybuilders or are outdoors people where they like to rock climb a lot, where they don't want a distortion of the breast at all when they flex their muscles. In those cases, you can put them on top of the muscle, but they have to understand there are higher risks with that.
Okay. Now we talked about the type of implants, where you put it, but exactly where do you make that incision?
Typically I use two different incisions. I either go around the nipple, which is called a periareolar incision. It's on the lower border of the areola, the colored part of the nipple, or I go underneath the breast. There is a third option, which is where you can go through the armpit to actually place the implant.
Now I also heard you can go through the belly button. Is that a safe procedure?
Well, I'm sure in the right hands it's a safe procedure. It's not done commonly. I would say there's only a few plastic surgeons in the country who do that. It does come with it higher risks, and typically those are implants that are placed on top of the muscle, and once again, those are going to lead to higher risk and potentially higher complications.
So the patient comes in not knowing exactly what size she wants to be. Obviously she knows she wants to be bigger. How do you work with her to find the right implant size?
Well, we actually let the patient decide that, but we also take some measurements during her initial consultation to help steer her in the right direction. And the way we help the patient decide that is we bring her into the office and she does what's called implant sizing, where we have her try on bras that have a certain amount of silicone in them. She puts a t-shirt on and she tells me what range of implant volume works for her. I then look at her measurements based on the implant that she's chosen, and I try to find an implant that's going to match the dimensions of her breast.
And so after you pick out the size, you discuss where you're putting the implant, the incision, the whole works. How long is the procedure? Is it outpatient? What is the recovery time like?
Typically a silicone gel augmentation takes me about 45 minutes to do intraoperatively. We usually schedule our cases for about an hour and a half because it takes time to get the patient into the room, put them on the table, put them to sleep, do the surgery, wrap them, and so forth. Essentially, that's the majority of the time, and then they basically have a recovery time of approximately 4 weeks or so before they're back to full activities. And I kind of increase their activities over the first 4 weeks to determine, what they can do and what they can't do.
So when would they return to work?
Most people return to work over a long weekend. So if they had their surgery on a Friday, by Monday, most people can return to work if they're not doing these strenuous activities or any heavy lifting.
And then what about exercise?
Exercise in the first week, most patients can get on a treadmill, do some light walking. After 2 weeks, I have them on a stationary bike. After 3 weeks, they can do the elliptical. After 4 weeks, they can run and do any form of activities they want.
So how long out after surgery, when do you recommend a patient having the implants replaced? Do they need to be replaced? Is it the 10-year mark that we've heard a lot of people say? What's your recommendation?
Really, it's important for the patients to know these aren't permanent devices, and a lot of patients do come in and tell me they thought these were permanent devices, or they come in after having a first surgery somewhere else telling me the doctor told them at 10 years they have to be replaced. And they need to be aware of the fact, yes, they are not permanent. The literature supports that most of these implants, silicone gel, has about a rupture rate of about 6% in 10 years, and saline's about 10% in 10 years. I would expect most patients between the 15 to 20-year mark would be the appropriate time at that point to replace them.
Now, do the implants have a warranty?
Yes, they are warranted for life. If there is a leak or rupture to the implant, the manufacturer does warranty the implant, so they would exchange actually both of the implants if that happened.
And then how would the patient know she needs to have them replaced?
Well, saline implants, if they leak, it's pretty obvious. You completely deflate, so the patient wakes up one morning or they're out and about and they look down and they see a pretty dramatic change. Silicone implants, it's much more subtle. They may not even notice any change to their breast. That's why we as plastic surgeons recommend that we see the patients routinely throughout the course of the implant placement. One of the first signs may be that the breast gets firm or distorted, and that's because the silicone gel can irritate the lining or the pocket and create a thicker shell, and that can distort the breast. The only real way of determining whether there's a leakage with a silicone implant is either to do surgery and look, or get an MRI, which is about 99% sensitive in terms of determining if there is leakage.
So if a patient does have a rupture or a leak, do many of them come back and say, just go ahead and take them out? Are they going bigger or smaller? Are they staying the same?
Well, I'd say most patients do want to have them replaced, and that is actually at every age level. I've had patients in their 60s come in and say, I still am used to having larger breasts and I would like to have them replaced. In terms of the size, it really just comes down to what the patient's interested in having. Most of the time they either go with an implant that's at a similar size or slightly bigger.
Okay. So what do patients tell you after they come back in, let's say a month out after surgery?
Usually they tell me they love them. But in most cases, they're very happy. They're getting used to, obviously, the change in the way they look. And they also want to know if this is how they're going to look, long term or what have you. And I usually tell them there's probably a little bit of swelling still after a month. But in most cases, they're probably going to look pretty similar to that. But almost uniformly, most patients are very happy with the decision they made to have the implants placed.
Can you tell a difference in personality when they come back in?
Again, I think that's somewhat variable, but I think a lot of women come in more confident. I think there's a confidence they feel now. They dress differently. They wear outfits that are maybe a little bit different than they're used to. Some women who've never had implants or never had any breast tissue would be hiding that for the majority of their existence, and now they can come in and wear tops or shirts that they feel make them look more feminine.
Dr. Prada, it sounds like the recovery is pretty easy. You mentioned that they can go back to work within 3 to 4 days. What makes that recovery so easy?
Well, I think part of it is a surgical technique. We try to do surgeries where there's minimal bleeding, minimal trauma to the breast tissue. But one of the things that we started doing approximately 8 years ago or so was placement of a pain pump. And that's a very thin catheter that we insert into the breast pocket. It does drain in a very low level of a local anesthetic, and that helps numb the pocket so the patients don't feel nearly as much pain. I find in my experience most patients have about 90% of their pain removed after placement of that pump.
Wow.
About 3 days out after surgery, they remove that at home. That first 3-day mark has allowed them to actually move around, increase their activity, so after it comes out, they're pretty much ready to go back to work or resume their activities.